So on the screen, we can right now we can see Mr. Sunil Kumar from Bhagalpur Smart City. We can see Mr. Chaitanya Bhatt from Surat Smart City, Miss Avni Gupta from Mahua Smart Cities Mission, and Mr. R. Srinivasan from Larsen and Toubro. Mr. Mahip Tejaswi, Sukhwinder Singh, and Mr. P. Balakiran will join shortly. I would request you to kindly continue with the webinar with our speakers.
Thank you, Richa. So we will start immediately, huh?
Yes, sir.
But this is just for it.
Can you just mute all the other mics, including Richa's? Yeah. So shall I begin? Great. So it's lovely to have such an interesting panel, right from north, east, west, south of our country. And as we all know, the topic of today's discussion is smart cities and how actually the smart cities are tackling the COVID-19 pandemic. So I will reserve my remarks in the end. Let the speakers speak first. And I don't have to introduce all the speakers because the speakers have already been introduced by Rich. I just wanted to convey that, look, I mean, these are the times when we would have never imagined. I mean, somebody downright south in Trivandrum. I'm just behind me. If you could just see, I mean, I don't know whether my camera is able to shoot that. The majestic Himalayas. I'm sitting in Simla. Richa is in Delhi. Someone is in Arunachal Pradesh. So these are the times actually in which we are living in. But at the same time, I think what is very important for all of us, the kind of urbanization that has unfolded in the last 20, 30 odd years, I think there are lessons that we all have to learn, especially when this idea of smart cities came up. And smart cities were supposed to be the flagship program of Government of India. So today, what we are going to do is we are having advocates of the smart city. We don't have someone who is going to actually contest their ideas. So of course, the attendees can really raise those questions. But I was speaking to one of my colleagues in Trivandrum, and he said, it's extremely difficult
for public policy and capacity development.
Can you just
leads the center?
Hello.
Yeah, what's this happening? Can you mute that mic? Hello. Yeah. So I hope you can hear that, huh?
Yes, sir. We can hear you. We have muted everybody.
Great. Actually, so we have advocates of the smart city, and of course, the attendees may raise questions, doubts, and even queries about how the cities have functioned. But the last word that I want to, the last remark that I want to make, and before I ask the panelists to really start off with their discussion, is that I was talking to one of my colleagues a former colleague in Trivandrum, and he said, the cities have actually very little. And the flow of the disaster management actually moves from the PM to the CM and to the DM. There is no M. The so-called junior CM, that's the city mayor. So the cities, we have the city disaster management plan of action, but that's not been ratified. Actually, we work through the DDMA. So within that, that is how cities are acting. It's wonderful.
नहीं घर पे कहाँ
So I think Mr. Chaitanya can take over now. Hello.
Hello, can you hear me?
Of course.
Hello. Hello, I'm audible?
Yes, Arun, can you mute me also? Yeah, please go ahead.
Sir, as far as Surat is concerned, during the pandemic situation, we adopted triple T IQ policy. I'm coming to directly to the point without going in any formality and thanking to the organization because I'm having a meeting at 3:30, so I will be leaving at 3:30. So coming to the point. Hello? Coming to the point, under the Smart City Mission, we are having a ICCC in place since 2016, and we have developed lot many monitoring system for door-to-door garbage collection, vector-borne disease, and all other things. So, at the time of this pandemic situation, the first instant was to track the visitors coming to the city. Along with me, Mr. Jigar Patel is here. He is our IT head, and his team has taken a challenge, and they discussed with us that we are having two systems in place. One is GPS-based door-to-door garbage collection monitoring system, and second is our vector-borne disease control system, where every 15 days our primary health worker visited the houses and taking the details from the citizens. So within 48 hours, a COVID tracker system was developed, and during the course of time, more than 5,000 visitors has came to the Surat. But we informed them. We have created an ID for individual visitors, and we have started tracking their places as well as whether their health also. And because of that tracking system developed by our team under the Smart City Mission and was monitored under the Smart Command and Control Center, it was easy for getting the details of every citizen who were required to be tracked. So this was the so we adopted triple two IQ strategy: tracking, treatment, tracking, testing, treatment, and then isolation and quarantining. Isolation of that patient and quarantining the close contact. So the first step was started immediately, and the things which was in place were later on been useful, because at the time of the active and passive surveillance also the system was very much useful. So this was the team, Smart City team has developed, and the monitoring was done by our Smart City Command and Control Center, as well as we have developed one war room at another primary health center, where the team, intern doctor team, were tracking each and every patient. So this was the new things which we have adopted in Surat. Apart from that, we have a dedicated and trained team for combat and epidemic. We have a solid waste management system based on GPS, what we told, and a special biomedical waste collection for different home quarantine people. So coming to all these things, the system which were developed were very professionally. The second thing, there was a issue of 15 to 16 less migrant labor in the city. So with the help of NGO, we have started giving them a food packet, and we have given 12 to 13 less food packet every day to all these laborers and poor people in the city, because the things were very closed. And really, the NGOs have worked a lot with our Surat Municipal Corporation, and we are able to handle all this situation for the providing them the food. So this was the things the Surat Municipal Corporation has planned for the workers, the migrant labor, as well as for the visitors has come to Surat, and later on the positive patient has been tracked on the system. Second thing, in Surat, we are having two big hospitals. One is civil hospital, and the second is Smear hospital, that is run by Surat Municipal Corporation. In Smear hospital, the capacity of the bed was 400 to 450, but they were having one stem cell building which was ready. So immediately the government of Gujarat, with the help of the team, they have created another 300 bed in the same premises. Same thing, we also upgraded our Smear hospital. Our Smear hospital is a capacity of 750 beds. There was a multi-level parking in the Smear, our hospital campus, which has a basement, ground floor, and 4-story. So we converted this multi-level parking into an isolation center and 540 additional beds. Hello. So coming to municipal corporation has increased the capacity of the city for providing the medical facility. Also has planned for a better tracking and treatment of the citizens who are either positive or they have come to the city, and the migrant labor by providing them a food. These three things has been done by municipal corporation as well as Smart City Surat.
Hi. So, if I could, because I believe Shri Chaitanya Bhatt is supposed to leave early. So, if there are any questions that are directed to Mr. Chaitanya, I would be glad to actually just ask Mr. Chaitanya to answer those questions.
See, I am there for another 15-30 minutes.
Great. So please wait, Mr. Chaitanya. Please wait. That is fine. That is fine. Yeah.
And if any technical question, Mr. Patel is here. He will reply.
Fine. Thank you, Mr. Chaitanya, for that brief comment. Of course, I have a question to you. Maybe before you leave, I'll ask you to answer that. And now we have Ms. Avni from Avni Gupta, who's the Deputy Director of the Smart Cities Mission. I think that's one of the most important persons we have today. So, Ms. Avni, I mean, you can take the mic. And if we could also see your video, because I was unable to watch Mr. Chaitanya. So, if you could just put your video as well as, the video on.
So you want me to go first, or do we cover the cities first?
I was given that you want to speak first, but then if you want to speak later, not your choice.
Good afternoon, everyone. I'm Avni Gupta. I'm Deputy Director in Ministry of Housing and Urban Affairs, Smart Cities Division. And as you all know, we have been going through this unprecedented situation, and all walks of life, all kind of people, everybody has been affected by this pandemic in one or the other way, or more than one ways, I would say. So, it's an evolving situation. It is changing every day, and we need to be very proactive, and we have to be ahead of the the problem to be able to tackle it and contain it. Now, various cities, people at all levels, the municipalities, cities, state, countries, they are all, using all kinds of ways and taking actions to contain this situation. It is affecting our economic, social life. Our economy is in a challenging position right now. So we need to be really, we need to go all out, and in from all aspects we need to tackle it. So smart cities mission, as you would as this webinar is titled. So all the smart cities have kind of risen to the occasion, and they have been very proactively playing a very important role in helping the city administration manage the situation. And this is something that we are very proud of, given that all of us are in this situation. That's a very unfortunate situation, but nonetheless, people from the smart cities cohort, they are managing, they have come up and with innovative solutions, ideas, making use of the available technology and the apparatus, and using it in the most optimal way to tackle and manage the situation. The overall approach, I would say that initially nobody knew how to, suddenly this was a situation that came out of nowhere for us. So the first is that we need to slow down, flatten the curve, what we are saying. And then whoever has got affected, we need to, fight and, save those people. And then we need to restart our economy and, go back to normalcy. So this is the main approach that we need to have. We need to flatten the curve. Then we need to fight what has been damaged and correct it, and then move forward. Now, I will talk about the smart cities mission specifically. So at the mission level, we depend on our cities, the 100 smart cities, to show us, to actually implement and do the action. The action has to be in the cities. Sitting at the ministry, we can coordinate the efforts for them. We can give them guidelines and advisories. But ultimately, the cities have to take action. And like I said, we are very happy that all the smart cities, they are taking, they are participating in full swing and with all their manpower to, help fight this situation. Specifically, the integrated command and control centers that have been set up in almost 47 out of the 100 smart cities, they are playing a very vital role in monitoring and managing this situation. So they are, all the city level surveillance, the mapping, the tracing of people, the identifying the hotspots, all kind of things are being integrated in a very integrated, holistic manner. It is being managed by the smart city centers, and which is a very, very significant thing for us. Now, the infrastructure or the facility or the technology that we had promoted through our mission, that is coming to aid for the entire city, not only the smart city area, but the entire city. And the smart cities have actually become like lighthouses for all the other cities and ULBs and states across the country and abroad also. People are looking at India, looking up to India rather, to find very innovative solutions and effective solutions. So I think we are using technology in a very optimal and innovative, extensively we are using it. We are using all kind of drones and AI technology. I think the city leaders, the city administration, the city CEOs, smart city CEOs will be able to give you much more interesting and innovative ideas and actually what they are implementing in their cities. So because at the ministry, we do promote them, we support the cities, but our role is more advisory. So although, I would give you one example of Bangalore Smart City, since Bangalore is not one of the panelists over here. They have done a commendable job on this front. They came up with a COVID war room within 24 to 48 hours of the announcement of the lockdown. So they used the Bangalore Smart City Command and Control Center along with some of the consortium partners. They have come up with a data consortium kind of thing. And they are, with the help of the private industry and institutions, they have set up a very effective war room, and they are actually managing and tackling the situation through that war room in a very effective way. So the private sector, the government, the industry, they have all come together in this situation and to fight it really. So some of the, Bangalore is one very good example that I would definitely highlight. Again, like Surat, sir mentioned that Surat has been doing very commendable job. Cities like Bhopal, Jabalpur, I think Jabalpur will be joining soon. So these cities have come out with drones, they're spraying sanitizers and disinfectants through drones and those kind of things. So very innovative things with whatever available infrastructure and technology, which is being done by the cities, and that is what probably we were waiting for this day, that actually the smart cities will come to aid for a larger cause. So, a lot of apps have been developed, and social distancing apps, and cities like Agra have done that very effectively, although they were in bad light. But the smart city, Agra, has been very effective in managing the social distancing part. So, these kind of examples, best practices have been coming, and as I said, this is an evolving situation. So these solutions are also evolving; they are improving with every passing day. And now, like I said, we have to go ahead of the curve. So now we are in a situation now where we need to just start going on the downward curve, where the cases start actually decreasing. We are really hoping that happens, and we bring the economy back on track. So, like I said, ministry has been supporting the efforts of the cities, and some of the innovative solutions that the vendors are providing, we are promoting and we are supporting that also. And so yes, so this must the e-meetings and also all these things have various the new, like the new normal. The normal has changed, and the smart cities have played a very important and prominent role in bringing about this new normal and making it attainable and workable. So that would be my open to questions, anything. So I think I would leave it to the cities to give you more specific and interesting examples what they're implementing. But this is the ministry. Thank you.
Okay, so thank you so much, Avi. And I hope you are there for some time, no? Because
yes, I think this session is till 4:30. I was told.
Yes. So we'll finish up by 4:30.
Yes.
So definitely there'll be certain questions, because there's certain issues pertaining to the contradiction brewing in between the district administration, and so can that be negotiated into the smart city? We'll come to that a little later. So thank you so much. And now we have Shri Sukhvinder Singh ji, who is the Director Town Planning and Urban Local Bodies, Government of Arunachal Pradesh. So over to you. Is he there or is he not?
So we believe Mr. Sukhvinder is still trying to join us.
So then Mr. Mahip Tejasvi ji is...
We ask Mr. Sunil now, and once the other speakers join, we'll let you know.
Hello, Tikendra sir. Hello, Tikendra sir.
Yes. So is Mahip there? Is Mr. Mahip there?
Sir, I would request you to invite Mr. Sunil Kumar from Bhagalpur Smart City.
Fine. Got it.
Yeah.
So we'll have Mr. Mahip and Mr. Sukhvinder later on, and since Mr. Sunil is there, who is the Chief Executive Officer of Bhagalpur Smart City. Sunil ji, we would love to hear some of the important interventions that you've been able to do, especially in the last 2 months.
Thanks Arun and Richa and Exhibition India for providing me this opportunity, and thanks Tikendra ji for allotting time to me. Of course, we all know that mankind is facing toughest time for their existence, and it is a hard time for all of us. I will divide this complete discussion, whatever we are having today, in 3 parts. Number one, as Mr. Tikendra ji was telling, that we all are advocate of a smart city here. So whatever decision government has taken 4 years back, then how that a smart city mission, how that a smart city initiative has helped in this pandemic period, this is very, very interesting to know. So we have to, of course, advocate that, and we have to prove that, we have demonstrated that. So we have to discuss regarding that. The second important is that during the lockdown period, that was the tough period for all of us. and that is still going on, of course. So what exactly a smart city has played a role, and what exactly different smart city has done? And third, and that will be most important from my side, and I will say this is most important because this COVID is not going to go away in 1 month or 15 days. We all know that they are going to exist. So we have to learn to live in this COVID period. So what is our present and future plan to deal this COVID challenge? That will be very, very important, and I will focus more on that. Coming to the first point, as far as the smart city initiative is concerned and how a smart city has helped in this COVID period, as previous speaker was telling that different smart city has played different type of roles. We all are having this 41 or 42 control and command system. Mr. Bhatt was telling regarding Surat. Avni was telling regarding Bangalore. So whatever infrastructure we have developed, that infrastructure has definitely helped us. And that we have demonstrated. So we can say with full confidence that smart city mission, whatever initiative government has taken, that has played a very, very important and constructive role during this period. This is very, very visible. This is very, very demonstrated. The second, I will say that, every city is having their own role, and every city is having their own situation, their own circumstances. Because as we all know that our logo is that we are making cities for citizens. But every city is having their own circumstances, own situation, own geographical location, own culture, own heritage. So the city has to plan according to their requirement. We need not to copy to Surat, we need not to copy to Bangalore. We here at Bhagalpur, a very small city of population of 5 lakhs, our situation is different, our challenges are different. So we have to plan accordingly. Even in this situation also, when this COVID period has come, we all know that Surat is facing different situation. They have to send the migrant laborers back to their native place. But we are having situation when we have to receive those laborers who are our people, and we have to ensure that a spread should be limited or a spread should be avoided. So those are the ground real situation we all are facing in different types. If I will say that coming back during this lockdown period and this COVID-19 challenge, what we had faced today, till today, different cities had taken different initiatives. Bhagalpur is also one of them, and we have taken different initiative. As you know, that number of Bihar was very, very less. If you will see 15 days back, it was in, I will say, 3 digits, 300, 400, like that. And we were very comfortable, But at the same time, the lockdown was there and the people were in the house. We were facing different kind of situation. People were having mental stress. People were having, lot of, I will say, the social issues, mental issues, emotional issues, because the people sitting here are having their near and dear 2,000 kilometers away from their home. So those were the challenges. So our strategy was based on that. So what was the strategy? We have developed app. We have provided them an opportunity to discover their own skill set, to discover their ideas, to discover their inbuilt qualities, and share the videos, share the storytelling, share the paintings, etc. to us. And in those apps, we have uploaded those things. So we have kept them engaged. The second thing, with that app, we have ensured that we should track the patient whatever we are having. We have also ensured that we should give the update to the people, because taking newspaper was not easy. People were not taking the paper, the hard copy of the newspaper. So we were putting this soft copy of the newspaper on the app and making available all the information across the globe to them. So those were the small initiative we have taken during that period of time. Apart from that, there was a whole lot of population who was suffering and who were not having food for 2 times. So we have ensured that we should provide food to them. So food distribution was again one important thing. The second important aspect, what I would like to focus more, and what we are facing now, that is very, very important for a state like Bihar and city like Bhagalpur, that we are expecting and we are receiving our near and dear, that is in the tune of around 25 lakhs. If I will say that the data of Bhagalpur only, we are expecting around 1 lakh. And that is a great challenge for all of us, because receiving them, keeping them in good mood, quarantine them, providing them all the facilities, providing them meals, those are the great challenge. But I will say that a smart city, along with municipal corporation, along with local administration, we are having great plan. We are ensuring that whoever is coming to Bhagalpur, we are receiving them with great encouragement and ensuring that thermal screening should be done almost 100%. The second important thing is we are ensuring that they should be kept for 21 days in quarantine. So we have developed quarantine center. So whatever infrastructure we are having schools, we are having colleges, we are having panchayats, that has got converted as a quarantine center. And we are ensuring that they should get good food there, they should get all the facilities required for the COVID period. We are ensuring that we should keep their morale high. So we are having yoga classes for them. We are having entertainment sessions for them. More than that, one important point I would like to focus here and stress it here, that again the important challenge and most important challenge we are facing, that the person who have come here, we have to provide job to them. We can't provide this free meal forever. This is for quarantine period, that is fine. So we have taken the initiative that we are mapping their skill set. If they were at Surat, if they were at Gujarat, if they were at Maharashtra, if they were at Bangalore, what job they were doing. So we are developing a database when we are ensuring that the skill set of those migrant laborers should be mapped. The second important point is, after mapping those, we are providing one format to them and mapping that they want to start their own something new or they want to do the job. So if they want to start something new, then what initiative government has taken, that we are developing 2 clusters in each and every district, and ensuring that the person who has shown interest to become an entrepreneur, government should support them. The third important is we are trying basically to keep them engaged and provide them job through Manrega and all the other activities, construction activities, and ensuring that they should get meal and they should feed their children, they should feed their family. One important point I would like to share with you all, as a smart city Bhagalpur, we have developed one new initiative that is called storytelling, and that is, we have named it as a lockdown ke panne, because we all have experienced during this period lot of stories, lot of experiences, and sharing is the best and important tool to make them aware, to ensure that a spread of this disease should be limited. So we have started this initiative. Under this initiative, what we are doing, we are having the story of around 15 stories we have developed, and that is basically on the basis of keeping in the mind that this would create awareness among the people, this should keep the morale of the people high, they should keep them engaged. So if I have to name some of the stories, so first story we have started, that is basically a story name is basically that Corona, how we have to fight the Corona and how to create the awareness. And in that story, we have taken the 2 characters. Both the characters have come from different part of the country, and one person has shown as a responsible citizen, has taken all the steps, has helped the administration, has get connected with the administration and gone through all the processes of quarantine and all. But one person who is basically emotionally attached, doesn't have any intention to do something wrong, but due to various reasons, due to his inclination or more emotional attitude, he has gone to his home, he has gone to his family directly. And that has created issue not only for him, for family, for whole society. So with these story, we are trying to give the message, the person who is coming here, he should become a smart people, a smart citizen of a smart city Bhagalpur. The second story I will say that we are trying to develop the bondings, sometimes you are not seeing within your house, within your family. So the person who is in quarantine at home, the person who is in lockdown period, 20 days, 25 days, 1 month, they are basically missing their social circle. He is missing their friends, and he is sharing that to his family, to his wife, that I am missing my friends. I have to go to office. I'm not feeling well in home. How long I will be here? And he is getting response from his wife that, do you know that I'm in quarantine since last 25 years? I am doing the homework. I'm doing the household job. I'm feeding my children. I'm helping parents, providing medicine to them on time. And during this course, we have forget that I am having my own thought. I'm having my own expectation. I have to go out. I have to explore my world. I have to explore my skill set. So those are the things developing the bonding. The third story, if I would say here, that is India this is the first step for India to become a global leader, a global guru. Why I'm telling so? That if I have to tell the whole world that this is our culture, it will be very difficult to them to convince that you have to adopt it. But the COVID has come in such a way that whatever culture we were having, that whole world is adopting. Like if I will say the mask in Bihar, all our elder people, all the people who is going out from the home, they used to keep gamcha. They used to, cover their mouth with that gamcha. So that is our culture. So whole world is adopting it. We are having culture to do the pranam, namaskar with our hands, with our folded hands. Whole world is adopting it. The second important, we were having the culture that if somebody is coming to my house, we have to greet them and we have to first offer them some water to clean their hand, to clean their legs and clean their mouth, and then only enter to the house. So those are the small things which we were having in our culture. The whole world is adopting those culture. So are we advancing at one stage when whole world is looking towards India and whole world is going to accept what culture we were having and they are going to adopt it. So I think that's all from my side right now, and I will keep it over to moderator, please, sir.
Thank you. And that was lovely, in fact, the way you expressed in storytelling. Let me tell you, in the pandemics, we have one of the finest poets getting developed. But mind you, they ridicule the government and institutions just like anything. So we are waiting for such poets to come up. Anyway, now we have Mr. Mahep, if I'm correct. I think Mahep has joined, no? Yeah. So Mahep, who's the former CEO of Gwalior Smart City. Over to you, Mahep, I think. Since you joined late, Mahep, I just tell you that the speakers speak for 8 to 10 minutes. And then whatever questions are being raised, we direct those questions. But just before I hand over to Mahep, Avni, there are many questions to you. Pouring in. So, and also on my WhatsApp. And one of the questions, before I forget, you please record it. And that is, the entire smart cities projects that have been developed, especially in the area-based development, the city plans, not even 1% cater to the health infrastructure development. So how do you really understand, foresee, whatever? So that's one of the major questions. And there are many others.
I'm not able to listen to you.
No, this is not to you. This is to Avni, actually. No, you please speak, because there's so many questions coming up to Avni. So I wanted Avni to just keep track of that.
Excuse me, I think there is some network problem. I'm not able to hear you.
So Mahep, over you can speak.
Can you repeat again? I'm not.
You go ahead, please speak. Well, if we are unable to get Mahep right now, shall we get Mr. P. Balakiran, who's the Chief Executive Officer of Thiruvananthapuram Smart City? Or is Mahib there? Yeah, Mahib, if you can just join. Richa, can you intervene? That's the problem with smart cities and logistics, you know.
Should Trivandrum come in? Are you able to hear me?
Please go ahead. I think you should. Yeah, please go ahead. Please go ahead.
Thank you very much for this opportunity. I think we have been here listening to a lot of wonderful ideas coming from various smart cities in how they are dealing with the COVID-19 pandemic. Am I audible to everybody? Yeah, thank you. Yeah, coming to the situation, I think everybody has spoken about it. How there are more than 59 lakh cases all over the world, and I believe that I think it's such a big issue. I think which has troubled everybody across the world. I mean, you can never imagine that a country like United States, there would be 17.6 lakh people who are affected and more than 1 lakh lives being lost for a virus which presently doesn't have a vaccine yet. And the great superpowers like Russia will have more than 4 lakh cases, and almost like more than 25,000 people died in those countries like Russia, Spain, Italy, UK, and Brazil, which is coming up to the second position right now. And we are not. I think we've been safe for quite some time, India as a country. But then, in the last 1 month, the cases started picking up so high that now the cases have almost jumped to 1.6 lakh cases, and almost 5,000 people losing their lives. And coming to Kerala, I would say that we have woken to this pandemic much ahead of all the states in Kerala. That's because the first cases have come in Kerala way back in January end. Immediately thereafter, the health department, which had a similar experience in dealing with the Nipah virus, which affected us in 2018. So we had a semblance of what to do and how to manage these issues. And based on that kind of exposure, we immediately started how the work should be done. And then we have set up a COVID-19 state control room, which has slowly become a war room of the state. And we started dealing with it at most seriousness. I mean, you wouldn't believe that more than 1.5 lakh people were put in quarantine in subsequent months. And they were being monitored on a day-to-day basis using technology, both by mobile apps and also by talking to them daily from morning and evening, and asking their whereabouts and well-beings every day. So with that spirit in mind, the smart cities and the corporation of Trivandrum also have done a great work in the sense that we today, as on date, corporation of Trivandrum area has a mere 51 cases. Which are in total, and of which 33 cases have been are active right now. And these 33 cases have actually come only in the last 10 to 15 days, where when the flights have been opened up and interstate borders have been opened up. And in fact, for almost 2.5 months, the number of active cases in Trivandrum were actually zero. This has actually happened due to various strategies. One, I said that we had the experience of Nipah virus dealing which happened in the northern district of Calicut in Kerala, which had much higher mortality, almost 85 to 90%. And there also we had used the strategy of contact tracing in a much larger scale, in those times, where every person who was affected, who he has gone there, the route maps, the the list of contacts and day-to-day checking were almost unknown before that incident happened, even in Kerala. But then we learned from the experience, but when it came to COVID pandemic, we realized that the same strategy can be put into the fact, except that those numbers in Calicut were in just 15 to 20. Here the numbers are in thousands, and the number of people for whom the contact to be traced are in lakhs. So the capacity has been expanded to a great deal, and Trivandrum Corporation also chipped in because the health department was in charge of providing them medical help and providing them contact tracing and knowing the well-beings, and the district administrations and the corporations were in charge of dealing with the other major issues, basically that of awareness and awareness campaigns, running the awareness campaigns. So we at Trivandrum, we have started giving huge awareness campaigns both in electronic media and on social media and in print media. We have started sharing brochures, pamphlets. We have created a vehicle of LED wall which is going around and starting to update people on where what things to be done. We have started a campaign. Government of Kerala started a campaign called "Break the Chain," wherein the chain of virus affecting to various people were supposed to be cut, and that was done through almost setting up 300 hand wash centers across the roads. So all the roads in corporation have had this public hand wash centers, which have been set up near the bus stops and on the waysides, where anybody who is just boarding a bus or coming down a bus or going into the shop can use this and maybe break the chain at that point of time. In fact, the sanitizers were also productions was also ramped up immediately after this pandemic, and more than 1,500 liters have been produced within the first 15 days itself in Trivandrum Corporation. But the second major responsibility which was given to the corporation area and the local bodies in Kerala is to take care of the food issues which are bugging most of the quarantined people. So for that, in Trivandrum Corporation, 25 community kitchens were set up, and 3 times the food was delivered on breakfast, lunch, and dinner. And these bookings for the free food could be done both through the mobile app and also through the website. And also there was a special call center which was set up not just for this purpose, for the entire COVID-19 response in Trivandrum, which had 7 parallel helplines which were working, and more than 50 Green Army volunteers were manning this particular setup. So then the cases were so high. In fact, till today, more than 27 lakh food packets have been delivered. In fact, there was one day on April 6th, there were 88,000 food packets were delivered to the needy on those days. Then the issue of guest workers, or as we call them, call the migrant workers in our state. So these guest workers, the survey was done by us. Almost 9,100 people were found to be there, and they were also again set up in a specialized care centers, and not just the food was given, but also medicine, sanitation, and all the sanitary paraphernalia was given to all of them. In fact, now the problem has gone to the final stages where the interstate borders are slowly opening up. Domestic flights have opened up. Vande Bharat mission is bringing many non-resident Keralites back to Kerala. So the cases have jumped in a big way. In fact, at one point in Kerala, there were only 15 active cases. Now it has jumped to more than 520 active cases in Kerala. So this again has come on to our responsibility, wherein we have set up around 28 corona quarantine centers, which were institutional quarantine centers, and now 500 people are put in those quarantine centers which have shown the symptoms. So these again, the entire dashboard has been created on the Smart City website also. There's a specialized website which is developed by corporation in COVID-19trivium.com. So these are again taken up in a big way, and we have heavily relied on technology, both on taking the complaints and also on the delivery side. In fact, the strength of this whole response of Trivandrum Corporation is based on the strength of the leadership which was provided by the Honorable Mayor and his entire team. And I would also have to mention that there is almost 2,500 special volunteers who have been picked up by the Corporation of Trivandrum, wherein these are the people who are actually doing the watch on the entire quarantine setup, and people who are under quarantine, knowing their well-being, getting to know their medicines that has to be delivered, the food supplies which have to be given to them. So these are all being done by this with this very, very vibrant set of volunteers that we have set up. In fact, now with the quarantining of the incoming people into Trivandrum Corporation, again we have set up this healthcare volunteer team. 200 per 200 houses we are having a special team which deals with those set of 200 houses per set 200 houses. So again, they are intervening in a very, very major fashion. From the smart city side, we are now heavily trying out new technologies. Especially, we are now coming up with vending machines which will dispense the masks, which are now part of our routine. So here I am wearing my own mask in office, and of course the sanitizers, which are which we wanted to have a contactless vending machines wherein we can use both the mobile technology payment gateway and have a non-contacted masks and sanitizer delivered to a very sending machines. Most probably we'll be setting it up in various places in a week or so. So these are some of the activities which we have done in Trivandrum Corporation, which has actually which has made Trivandrum a better place. Even in these tough times, where we have reported just 2 deaths in the last 3 months. But then we want to be careful, cautious, and be ever ready in dealing with greater troubles which may come in the coming days as well. And any other questions I would be happy to take up. I hope my experience will also help other cities as well, as we are learning from the other cities to deal with this global pandemic. Thank you.
Thank you, Bala. I learned you are supposed to leave early, or will you hold till 4:30? Will you be able to hold back?
I'm just going for a meeting. If there are any quick questions, I can take it up right now.
I think the one question which comes from attendee 150, if you could read. Okay, I'll read it for you. So everyone mentioned about initiatives taken by smart cities as coping mechanism to COVID scenario, which were quite interesting based on their context. But I would like to know, what are these cities doing towards community hygiene practices in terms of sanitation, people using public community toilets, which is one of the reason of contamination. So one, and the two question, and the second question comes from me, Bala. Okay, and that pertains to, we have seen lots of people. I mean, the exodus taking place from cities, especially from smart cities. Surat is a vibrant example for that matter. So how were you able to hold them back, as you call them, guest workers? I mean, what is the condition of labor hostels? Because are you also able to incorporate the construction of labor hostels into this smart city strategic vision that you have built for the city?
Yeah, absolutely. I think you've raised very pertinent questions. One is, of course, the sanitation, which has been bane of many cities, and Corona has put an immediate premium on making our cities clean. Coming to the corporation, which is dealing with this, is we have already started. In fact, the monsoon arrives very quickly very early in Kerala. In fact, we have been getting rains for the last 10 days already, and the monsoon is expected to arrive by next week. We have already started a ward level cleanliness drive. Earlier, we used to give 35,000 per ward to do a basic cleaning, one-time cleaning exercise. But now we have increased it by thrice. In fact, the corporation has now given 1.35 lakh for each ward to do the entire cleaning, both on the antibacterial side. Now we are also concentrating on the public toilet infrastructure as well. So this has been on top of the agenda of corporation. In fact, Honorable Mayor has personally been involved in this planning and in execution. coming to the second question which you asked about the migrant workers, as we call guest workers in our state. Unfortunately, in fact, the loss for Kerala is immense in the sense that the premium construction season in Kerala is from January to May, which we have lost completely to COVID, and our rains are already starting. But then, so what the point I want to say is most of the migrant workers or the guest workers were in Kerala doing peak construction work when the pandemic stuck. But then we took it on our chin, and when Honorable CM said that these are our guests, and in India, as you know, guests are gods. So we have taken utmost care, whatever possible, within the state of Kerala, and we have given them all possible facilities which we can give them. As I told before, we have given them free food, medicines, and also all the sanitary equipment which are required. Within Kerala, we have within the Corporation of Trivandrum, we have set up 3 camps in SME school, Chala Government School, and Manakkada Tirunal High School. So, and again, the same thing was done for all these workers who have asked for refuge. And I would say that has worked well. I mean, I have never heard of any large scale, not even small scale migrant workers unrest in Trivandrum in these last 3 months. That is to the credit of the activities which have been done by corporation and the state government. But then I think now when the Shramik express trains have started, people have obviously started going back to their respective states. And because the construction period is also ending in Kerala, which will only start after the monsoon season. So we are sad, but then I think the family comes first for everybody, including the guest workers.
Thank you, Bala. That was lovely speaking to you. And of course, I mean, Kerala has been definitely a lighthouse for the entire country. Thank you so much. Mr. Maheb, are you there? So we can just take over the mic. So if Maheb, Richa, can you hear me? If Mr. Maheb is not there, then what do you suggest? Shri Sukhvinder Singh. And let me also apprise, Bala is the Chief Executive Officer of the Smart City, not like in India. Probably that was flashed wrongly here. Yeah.
So I would request, why not bring in L&T, Mr.
Fine, Srinivasan. Mr. Srinivasan, who's the head of Smart World and Communication from Los Angeles, we would love to hear from you how L&T can intervene, especially in this pandemic. I mean, how can technology help people to really reduce the number of deaths? And of course, the kind of GPS we've seen, instead of the GPS, we've seen people actually being crushed on the rail track. Because the only GPS that they had was the railway track where they were crushed. So over to you, Mr. Srinivasan.
Yeah, good evening, and I hope you're able to hear me. So first of all, thank you very much for giving me this opportunity to share the platform with some elite speakers and CEOs and, for Smart City Mission and commissioners and all that. Thank you for giving me this opportunity. I'm probably the only one from private industry to be talking to you. So anyway, I'm not going to take much time because not much time is available, but since about more than 400 people are around, it's also important for me to say that Larsen & Toubro started this business of smart world and communication business specifically to address safe, smart and digital infrastructure. And as I speak before you, we are almost present more than about 20 cities by way of safe city, by way of smart city, by way of smart infrastructure and complete digital communications. Some of the murky projects that we have done is complete Mumbai surveillance project, where we have put about 5,000 cameras connected to the control center. And recently the Prayagraj Smart City, what we did, well, complete crowd alert management system, which was, almost about 27 crore of people was effectively managed. And very recently, and of course the last time as well, the early warning dissemination system, which we did in Orissa, where, complete alerts through alert sirens, asking the people to go to the shelter, including the location-based sensing, which means you've got a coastline of about 500 kilometers and you want to alert the people only for about 40-50 kilometers, try calling, and this technology will really find out and then tell you who are the people to be alerted, and they can go back to the shelters. So these are some of the projects and complete. Tamil Nadu, we have connected about 6,000 schools, and in Bihar, all the colleges and universities we have connected. So these are some of the projects that we have done. But what is important here is, when we did the smart city, we never thought it was going to be so useful to all these. I mean, some of the, like this COVID pandemic and all that. So what is important is that you have got a command and control center, and which can integrate various things and then give you the benefit. So the youngsters and the people who are watching in this particular seminar should really understand it is not just for COVID. Any kind of disaster which is coming, this is going to give you a fantastic opportunity for you to put the solutions in place. So what we have done, many of the control centers have been very effectively used, particularly in Mumbai and Hyderabad and Nagpur, Pune and all that, where whenever during the lockdown period, the crowd alerts were very effectively sort of measured. We even used drones in one of the place to find out the crowd alerts, and immediately it was alerted to. And this also depending on the requirement, like crisis is an opportunity. Like in one of the places when they said beyond 3 kilometers a vehicle should not travel, we put some automatic number plate recognition in different locations, and it will find out whenever it goes beyond 3 kilometers. Immediately you give an indication to the local police, and they go on alert, and automatic e-challans are issued. And one of the places what we have done, they are asking about the health care facilities and all that. Like, somebody wanted to go during the lockdown period. We had created a mobile app where you have to fill up, if somebody is not well, he fills up the application form. Immediately a QR code is generated, and he can show the QR code and then move around. So there are multiple things that we have done across in this particular COVID pandemic. But the beauty is every smart city operation control center has been very effectively used as a war room, in almost in every place. Just to give you some kind of and one interesting thing I would like to say is we are doing the first smart meter project across UP, Haryana and New Delhi, where we are putting about 50 lakh meters, and these do not require anybody to go to the house and take the readings. So this way you can avoid the social, what we want to maintain, the social distancing and all that can always be done. So just running through, it's always good to have some kind of statistics which will really tell you how the whole smart cities have been very effectively utilized. Like, the crowd alerts has been about 54,000 crowd alerts across the country that we have given. And the vehicle violating lockdown restrictions, almost about 7.2 million. And the curfew violating through vehicles, more than 3 kilometers is about 6 lakh. And complete dial 100 facility which was used. And our variable message display, what we have put, were used to address and to circulate messages to the people. And your public address system was effectively used when people need not be, crowding in a place in the lockdown and all that. What I'm trying to say overall is that we have the entire systems, what we have provided in different locations, have been very, very extensively utilized for this particular, this COVID. And as I said again, it's not just limited to COVID, any kind of disaster. The schemes are available, the solutions can always come. When you want something to be addressed immediately, you can address and then create an integration in the safe and smart platform. So that way Larsen & Toubro is extremely happy to have been associated, because on a time of crisis, we are able to very effectively utilize the various things that we have installed and the solutions that we have provided. I'm not going to take much time. My colleague is there, Mr. JBS Ramakrishna, who will be able to even share with you something more, what he has practically done in different, and couple of solutions that we are locating in Mumbai. What we have done, we have gone for a thermal camera which is contactless. You can just go and stand there, and then it will immediately find out and then tell you the temperature. And the facial mask recognition as well as the distancing. These are the two solutions that we are developing. But what I would like to tell the viewers is that whatever is required, if you can probably come out and then say this is what is required, I am confident that we'll be able to develop the solution and make it. See, ultimately it is not the numbers. I'm not happy with the numbers that 6 lakh, 7 lakh. And what I'm trying to tell you is this number should come down, but there is a mechanism by which we can bring in discipline. So that way Larsen & Toubro is extremely happy to have been associated, in this particular monitoring and alerting events and all that. And we would love to do more and more. Once again, I thank you very much for the wonderful opportunity that you have given me. If you have any question, immediately I'll address. Otherwise, Mr. J.V.S. Ramakrishna is there, he will address. Thank you very much.
Thank you, Mr. Srinivasan. I believe if there are certain questions, definitely.
Yeah, right now I'm available here. You can ask me, but otherwise, J.V.S. Ramakrishna is there, he will address.
Okay, fine. Thank you. So, I think our last speaker is Mr. Mahep. Can we have Mahep? I can't see Mahep, by the way, on the screen. Okay, fine. So we can start off with questions. So, Avni, I think I will ask you to answer these questions. The first one that I raised, would you like to take all the questions together or one by one? I think I'll put all the questions together. The 3-4 questions that are raised.
Okay, no?
Fine, sir.
Fine?
Covered the content.
Okay.
Avni? So one question has already been raised to you. And so what I suggest is I just raise 2-3 questions that I can see on my screen. And
your voice was breaking in between. If you can just repeat it quickly.
Can you hear me now better?
Yes.
Great.
Yes.
So what I'm going to do is I'm going to raise, I think there are 2 or 3 questions pointed at you. So I would like to, one I have already asked, that's about the health infrastructure. And the second one pertains to, it's come on my screen. And it says that why no innovative solutions to tackle the labor problem and reverse migration? Of course, you gave Surat as the best example, and but we saw violent clashes there, no, didn't we? And how do this see this problem and plans to tackle this? Primarily, how does the smart cities figure in this whole question of reverse migration? And when we speak about technology, is the artificial intelligence will it be used to increase healthcare capacities in concerned smart cities? I think that it links to the first question. And I think there's another question that I wanted to deal with it when I concluded. But since you are there from the Mahua, from the Ministry of Housing, of course, Urban Affairs, we have 2 CMI reports. They're very interesting reports. The first one pertains to massive unemployment that is almost 27%, but also to the willingness to work. Willingness to work that was somewhere around 72% has come down to 38%. What do you do in these cities when the labor doesn't come back at all? They've gone, and the way they've been treated, and we've seen captions in the newspaper that we will live with salt and maybe one roti, but we'll not need to come back. So smart cities are not just technology, Avni, aren't they? They are for the people, no? And the people have migrated back with such agony, pain. What do you find is the role of the ministry, or do you really have to revisit the architecture of the smart cities? Please go ahead.
Yes, thank you for the questions. I'll quickly take the health questions together, both of them together first. So, health infra, it's not that it's not a part of the mission or it is neglected deliberately. We need to take one step back. So, how these projects were initiated. So, initially, all the cities made a smart city plan or proposal where they explicitly wrote down and the kind of projects and the projects they wanted to take up in their smart city plan. So the projects got finalized at that time, and whichever city wanted, they have taken up health projects. So nobody knew that we were going to have a health pandemic and health crisis suddenly towards the fag end of the mission. So the projects were initially selected as per the requirements and needs of the people of the city. There were huge public consultations that were undertaken at the time of the initiation of these projects. So of course, some cities have taken up the health projects, some haven't. So we don't tell the cities to. Sorry, you're not audible. Your mic is on mute, sorry. So even having said that also, so even if the cities haven't taken up any projects related to health specifically, there is nothing stopping them from using the command and control center, and cities are actually using the facility for quarantine testing and centrally monitoring people, tracking people. So in fact, I would say that I would put it in a different perspective, that even though the health projects or that aspect may not have been covered by a few cities or some cities, but now the cities are actually using this infrastructure for that purpose. So because we have that flexibility and the capability is there in the system to, you can just come and plug in the apps and, the applications and just use it. So people are, telemedicine, telemedical advice and consultation, those kind of things are getting implemented through the command and control centers. Containment zones are being monitored, the hotspots, like I mentioned. So it's not that, so like I said, that few cities who envisaged the importance of health and taking up health projects under the mission, they have done that. Otherwise, the projects, they were already, kind of finalized during the initial period of the mission. So that would be my, so using AI for healthcare, like you said, so definitely those capabilities are there in the system. There's nothing stopping the cities. So like the CEO of Bhagalpur said, that it varies from city to city. Every city is unique, and we cannot just give them one overarching rule from above, that now that there is a pandemic, then you need to have these A, B, C, D solutions. So we leave it entirely to the city. They can make use of the facilities that they have created. And cities are doing that. So this is the first. The second is the innovative solution for migrants. Yes, the migrants and the labor and the casual labor problem is a very genuine thing. And I would say that this is not limited to the smart cities. It goes beyond smart cities. So as a mission, so whatever facilitation we can do at the city level, at the smart city level, that will be provided. But it's a larger issue. It's not really pertaining only to the smart cities, and smart cities are a part of a larger subset where people are going from one particular area, some cities to particular 2 or 3 states. So of course the states need to step into this. That will be a more effective level of intervention for these. Of course, center, there is labor ministry, there is of course the PMO monitors all these things. So I think those ministries will have a larger role to play in this. Of course, whatever is required from the smart city infrastructure and the manpower and human resource, of course, connecting with the citizens has been a very strong point of the smart cities mission. So definitely, if that kind of role is required from the mission side, then we'll definitely step in. But there has to be it has to fit in the larger scheme of things for this tackling the migration issue. And the last one, again, unemployment and willingness to work. So yes, of course, there are other missions. Of course, smart city missions is there. But like we have within our ministry, we have the National Urban Livelihood Mission. And of course, we have the corresponding missions and programs in the rural development ministries also. So of course, smart city works in consultation and in convergence with all these schemes. So of course, there's nothing, like I said, there is nothing that you cannot take up in this. So anything which makes life better for people can be done under the smart cities mission and taken up under the mission. So yes, of course, the unemployment, again, that's a bigger problem. So of course, economic aspect of this whole pandemic is going to be a very, very big, highlight of the whole situation. How we come out of it will be, will tell us who is the winner at the end of the day. I hope maybe you can just...
Thank you so much for defending the government just the way you should have. Yeah, thank you so much. So Mahep is finally there. I'm so sorry, Mahep, we couldn't get you earlier. I think it's now your turn before we switch on to more questions that we have in the pipeline. Can you hear, Mahep?
Yeah, I can hear you now.
I'm so sorry. We kept on holding you back, but then the logistics and technology at times really called us back. Yeah, please go ahead. Yeah.
So
and I'm the former chief executive officer.
Yeah. Thank you so much. Thanks for giving this opportunity. and it was really a nice experience working with Smart City Mission. Since I have left Smart City Mission recently, so I can recall everything what we have done over there. Especially Gwalior was a stalwart in terms of setting up new innovative measures to handle COVID crisis. Initially, at the outset itself, we started with a WhatsApp video calling facility, because in the beginning, we started up with 4 helpline numbers, which was proving very supportive for public. And we had a team of doctors also who were sitting with the landline numbers, and they were suggesting to patients about what to do or what not to do at the crisis time. But patient was not getting satisfied, and there was a panic situation all around the city. So we started thinking about face-to-face interaction about the patient with the doctors. So in our command control system, we started using our situation room and the video conferencing room. We started using as a WhatsApp video calling room. And there was a team of doctors who were sitting all along the day and 24/7. They were sitting there, and they started giving suggestions, and the panic situation was handled very well. Still, that is functioning over there. And as of now, I think we have handled thousands of video calls, and not only from Gwalior, from different districts of the states, and even from, you would be surprised, even from Noida, Gurgaon, everywhere we get call on WhatsApp. So initially, that was the thought, to remove the panic and to handle the panic situation in the city, and that worked well. Then after few days, after 3-4 days, we started thinking about pooling of data, because you need to track each and every suspect of COVID, and then you need to monitor his health or her health, and then you need to understand whether that is going to be converted into severe symptomatic or asymptomatic or whatever is the situation. So we devised a system called COVID-19 Suspect Tracking Information and Management System. So which was designed by me and a colleague doctor. So we created a format, and in which that was that could be filled by smartphones directly by the survey team. And as you know, there was a provision in MHA guideline that there must be a team of incident commanders who would be visiting in the field areas, and the incident commander was responsible to give feedback about each and every queries or complaints which we were getting from the field. So we created a template on smartphone in which there were 4 basic points. One was diagnosis, then advice, and then remark. So in the team of incident commander, there was a doctor with incident commander and surveyors. So whenever doctor was visiting to a patient, he used to fill the form on smartphone. Then there was category like whether the patient is having fever, or he's having cough, or he's having body ache. So everything was ticked on a smartphone, and we were getting each and every data on our central server in command and control center. So this way we started, and we finally, till the time I left the position, we could monitor around 5 lakh citizens in Gwalior district. So we had data of 5 lakh citizens, whether they are having high fever, they are having cough, or they are having any other symptom, or they are asymptomatic patients. So we had n number of fields we could generate from our system, like whether asymptomatic or symptomatic or severe symptomatic. And according to the situation, we could send them to the A, B, or C category hospitals, which were identified as per the MHA guideline. So you very good question you asked initially with Avni, that you said that smart city is not you were pointing that how smart city can function as a epicenter for each and every activity. So I would say that smart city is not a tablet which can be taken for each and every disease. But what happens, if the leader is nice, and for district collector I'm telling, every district collector, if they are trying to, am I audible?
Yes, you are audible, but Yeah, please go ahead. Please go ahead. Yeah.
Yeah. So each and every district collector has to take lead, because in our city we created Smart City Command and Control Center as a center where IG sir, divisional commissioner, collector, SP, every had number of meetings over there. We were talking to all these stakeholders, the interns, doctors, which were who were involved in the COVID operations. They were coming there, and we had a long session of meetings and trainings and everything. So all the practically all the offices were they were become. I mean, I won't say that all the offices were dysfunctional, but typically Smart City Command Control Center was the main office of the COVID operation. So when you handle any emergency situation from one center, it has many benefits, but you handle in different from different segments and from different offices, you don't get the desired result. So in our city, that was the benefit, that we could command control center, and every data was there on tips, handle it from our and so that we could manage it very well. Another innovation which we did, that was Namaste Gwalior mobile application, which was the tagline was making life easier. So we started doing home delivery services with our 500 volunteers, and there were n number of not volunteers exactly, they were on paid salary basis, and there were AC mechanics, there were plumbers, there was electricians, all these small things which you can think about, the home accessories and everything. So that way started helping the city. So the situation in lockdown, which everyone was feeling that what to do in this crisis time. So that we tried to ease out, and this way we try to develop a connect with the public.
I can't hear actually. Thank you, Mahip. Probably we lost Mahip in the end, but those were some very important comments that were made by Mahip, especially with respect to the work that they have done in Gwalior. Now, I think there's a fundamental question that I wanted to raise, of course, to Maheb, but since I can't see him on the screen, and it is a very generic question, of course, that speaks about what would be the future. I mean, the future course of governing cities. But well, I'll try to deal with it when I just summarize the entire discussion. So, Richa, if you would you pose the questions to the because we are already 4:30, we are actually running above time now. So, what do you suggest? Shall we take a few questions and then we wind up? Hi, Richa, or Arun, is there anybody?
Hi, I think Richa is not
we can
there.
take a couple of questions.
Sorry, Arun?
Maybe we can take a couple of questions and then wrap up.
Okay, great. So, any update? So, but the point is, the questions are not directed. So, and who amongst the panelists, who all are there live right now? I can see Avni, but I can't see anybody else. Arun, can you just guide me?
Sir, I'm checking. In the meanwhile, if you have any question for Ms. Avni, then you can go ahead. In the meanwhile, I'm checking.
Okay, so Avni will have to answer these questions because we don't have any other. Okay, fine. So let me start from the top, and if there's any other discussant, I mean, who's placed the views, more than welcome. So he says, I am Ashwin, smart solution provider. How can I reach to you to showcase our smart solution and to know what solution you're looking? Any update about smart street light for smart city project? Okay. And what is the library's position in smart cities concept in India like Hyderabad? So now, Avni, how do you want to respond to all these questions?
I think not really relevant questions. People are just posing anything. So for the solutions, I think they should contact the vendors and the smart cities directly. We don't intervene in the selection of vendors and solutions. So I think that they can approach the cities individually.
And then there's another question, how the home quarantine is administered, monitored. Very, very basic.
So some cities, like I said, they're using apps and for doing this, and they are being controlled and managed through the command control centers in some of the cities.
Maheb, since you are there, can I just can you hear, Maheb? Are you able to listen, Maheb? Because we can see you on the video. Maybe not.
No, I think he's not.
Okay. Can you hear me, Maheb? No. Okay, fine. So. So what type of new solutions requires for smart city after facing the COVID condition? I don't know. Would you like to take that? Avni?
So we basically need to look at building more resilient cities. So like one of the speakers mentioned that the situation is not going to end very soon. So we really need to work, work out a new normal. So definitely, I think cities have started working towards that. For example, I'll give you very small examples. They have started, putting these dispensing machines and all those things for masks, like one of the speakers mentioned. So these kind of things, and plus, like the migrant labor issue, that will have to be tackled very sensitively, because now that people have gone back, like you said, to their hometowns, and how to bring back the labor to the workplaces, and how to get the economy kick-started again. So we are just reacting and responding to the situation. We need to revitalize and rebound also. So definitely we need to work towards that. I think we are not still in that frame of mind. We are still facing, and we are in the middle of that crisis and situation. So definitely that building resilience in cities through very innovative solutions will have to be the way ahead. And that has to be in terms of economy, in terms of climate, in terms of social behavior. There are going to be a lot of social behavior changes. People have started working from homes. That is going to become a part of the new normal. So all these are a whole lot of aspects. It will touch each aspect of our life. So that is a much larger issue. It's a very generic question that not only smart cities but everybody else needs to think and answer this. So like transportation, the economics of transportation and how we use it.
If physical distancing be followed, what will happen to public mobility?
Yes, that's a very big harm. So, and that's much beyond smart cities or much beyond Indian smart cities. I mean, we have to tackle it at a global level. And there's going to be a lot of behavioral changes, definitely.
So I think this will be the last question, then probably I'll try to sum up. Most affected emotionally and physically are senior citizens, especially when isolated. No servants, of course. No connection with their age group. Is there a system to assist this group under the smart cities concept?
So again, there have to be very city specific. We don't have any central or advisory for this, definitely. But like we said, that going ahead, there could be but as of now, there's nothing that directly not related to. Of course, cities are taking up individual projects.
Okay. So if I think I would like now to use this. I think I'd like to wind up now. Yeah. Okay, because there's no one else to answer the questions. Well, thank you so much. Thank you all the guest speakers who were there, right from Avni. I mean, thank you, Avni, for staying all along. I mean, normally actually it's an inverse that has happened. Let me be very frank with you. Normally in our conferences, the city leaders used to stay back and the Government of India officials used to move out.
This again, that they have actually got me. They're acting on the ground. We are just coordinating efforts for them.
Thankfully, that we have the Government of India official with us, and of course the city governments over there. They're busy in the pandemic as well, so we can realize their importance there in the cities. So as I said in the beginning, actually we were speaking about smart cities, and all of our speakers were advocates of smart cities. And I remember writing the smart city plan myself when I was the deputy mayor in Simla, and I was the directly elected deputy mayor. I mean, what all we went through. So so I don't really want to contest that idea because this is not the platform, but I think we really have to revisit some of the basic formulations and foundations. Because smart cities also means cities for the people. I mean, the entire smartness has to revolve around that. And if I mean, we smart cities are unable to hold up our migrant people, not even for 24 hours. The exodus started immediately after that. I mean, what are we building up? I mean, I think we really have to revisit that. And of course, there are innovative solutions. That's why I brought in the whole example of Kerala and Simla also for that matter, where the Britishers constructed labor hostels. So housing is one major problem that we don't not even discuss. And Avni would correct me, but I think 80 to 90% of the area-based development, the redevelopment projects that have come up either in mobility, water, sanitation projects. Just 1% in health. Of course, we didn't even foresee at that time that such a kind of pandemic or epidemic will strike us. So I think that is something where we really have to, really need to understand. Why are we saying housing? Because public housing, I mean, there are many studies, I don't want to go into all those details, but if we have to sustain the so-called resilience that we talked about, 25% of the housing must come from public housing. 75% we can understand the real estate or other giant players can really play into that. But actually in India, we've gone down from 6% public housing to 3%. Now, this is not sustainable. This is unsustainable. And at the same time, if we are not able to build parallelly rental housing or labor hostels, how are we going to sustain our cities? That's one point that I want to flag. Also, there are many other things. The other thing is about the entire generic question. Why I said generic question, I wanted this question to be addressed to Mahek, but since he has left, now let me just flag it off. Why it is important? Because I was quite instrumental. Of course, I did not write, but I was part of the team and was quite instrumental into writing this city disaster management plan of that. Now, and then in the NPDRR, the National Platform Disaster Risk Reduction, I presented that. I mean, the Simla was one of those few cities that were able to create that. And of course, we were able to map our vulnerabilities, create those atlases. Now, you see, under smart cities, something very important. Once you have a CDMA, it is not ratified. And as I said in the beginning, because we have our officers, they will not speak against their own governments. But the pinch that they feel, because had they been given a free hand, the city mayors, the city commissioners, or even the chief executive officers, things would have actually turned a little different. And under the CDMA, and now of course we found the latest notification that has come from the MHA, they are focusing on cities, because this pandemic has spread from the cities to the rural, actually, and this reverse migration has also taken place. So I think the principal intervention that could have happened. So we have to revisit the entire disaster management plan of action. We have to bring in focus our 4,000, 5,000 odd cities back, and we have to actually fix on the onus onto the city governments and to the city players. And if we do not do that, I think then we are missing some. Take, for example, a very, very small example. I mean, all these smart cities. And the simple thing could have been, had there been community kitchens like Trivandrum did. I mean, imagine the kind of exodus.
So we will need to wrap up soon.
Able to resist. I think that's the second point I would like to. And the whole business of poverty. Just try to. It's humongous amount of poverty that is existing in cities. We have the Oxfam report. We have the report from the CMI. And the Oxfam report is rather startling. We have to actually understand the whole business of smart cities. The top 10% asset holders and the bottom 10% asset holders in rural India, the difference is 500 times. That's Oxfam. And in urban India, is 50,000 times. If we do not address this vulnerability, the cities are not going to bounce back. Thank you so much, Avni. I'm really glad that you've been all through. I know, because I know I've been part of the government. I mean, how difficult it is to really speak for the government and speak so well, despite the fact that we have faltered so badly. And lastly, non-COVID deaths that have occurred not because of pandemic, but people going back, has almost gone 800 to 900. These are not smart cities. Actually, we have to revisit the entire idea. Thank you, Exhibition India. Thank you, Richa. Thank you, Arun. And thank you all the attendees. I think there were more than 500. Thank you so much. With this, I would like to. And of course,
thank you very much, sir.
With a vision that is a lot more.
Thank you, sir.
Thank you.
Thank you very much.
Thank you, Ms. Avni.